Hi, I'm Nicole Goyle, and I'm here with my husband, Dr. Ashu Goyle. He is our pain and regenerative medicine physician at Integrated Spine Pain and Wellness. We work together, and I do all of our regenerative aesthetics as well as lifestyle management. Today we are here to talk about PRP injections. PRP injections is a form of regenerative medicine, and if you've paid attention to previous videos, you have seen our talk on regenerative medicine. But specifically, we want to go into what exactly PRP injections are and how can they help somebody who is dealing with chronic pain. So, Dr. Goyle, can you give us a little bit of information about what exactly PRP injections are, who's a candidate, and how it can help somebody who's dealing with pain?
Sure. So PRP stands for Platelet-Rich Plasma.
Okay.
So this is a technique where we withdraw blood from the patient. So it's their own blood product, it's their own platelet-rich plasma. We withdraw usually 60 to 120 cc, so a large blood sample, and we take this blood sample and we spin it into centrifuge. And what happens when it spins at a high velocity for around 10 to 12 minutes is the red blood cells all settle to the bottom, and there's this layer of what we call plasma. Now the plasma has all these different growth factors. It has white blood cells in it, and it also has a small layer of concentrated platelets. Okay. So this platelet-rich plasma, this concentrated layer, is full of growth factors. Okay. And we can use this layer and inject it along injured tendons, ligaments, inside joints to help not only reduce inflammation, but ideally, potentially, to help heal tissues that have been injured. Okay. So, our most common application for PRP is knee joints and for what we call golfers or tennis elbow. Oh, okay. So epicondylitis, lateral or medial epicondylitis. Okay. So that's where the most of the evidence is. So for patients who have osteoarthritis, they may not be a candidate for steroids, or they've gone through steroid injections, they've gone through gel injections, extensive physical therapy. They're trying to avoid knee replacement. Okay. This may be an option for them. Okay. So when we concentrate these growth factors, we're concentrating what's already in their own body by 5 to 10 to 15 times as much into a small volume, and we put that strategically in the places that are injured. Okay. One thing about the knee and most major joints is there's not a lot of blood vessels there. So if you do get a meniscal tear, for example, like a medial meniscus or a lateral meniscus, these are the cushions inside the knee joint, their healing potential is very limited. Okay. And it's because there's no blood flow. When that tissue gets injured, it doesn't bleed extensively. Okay. Platelets are healing cells in our body, if you will. Okay. And so by delivering them to these injured sites, we can stimulate healing. That's the goal. Wow.
This is all natural. This is
all natural. Yeah. I mean, it's natural.
It's your own body healing itself.
Correct. Yeah. Wow. So in the famous words of Dr. George Chang Chin, one of my mentors in regenerative medicine, this ain't pixie dust. So it's not everyone is going to benefit from it. Not everyone is going to be cured by it. Okay. So this is something you want to do when you've exhausted all other options. This might be the last step before surgery. Okay. It's not covered by insurance. At least most insurances don't cover it. So it is cash pay. And I will stress that to my patients. So it's like, this is an option for you, but you have to understand that you may or may not respond. Okay. And sometimes it can take several injections. I mean, everyone's body heals differently, right? Okay. And everyone's plasma is different too. So with these PRP injections, there's a pre and post procedure protocol that we implement that ideally will allow us to have the most successful outcome. Okay. So, and this involves dietary changes, lifestyle changes, and then aggressive physical therapy post-procedure. Yeah.
And this is really touches on like an anti-inflammatory lifestyle, correct?
For sure. Yes. Yeah. Avoiding processed food, refined sugars. Yeah. Exercising, drinking plenty of water.
Now, following these guidelines that you implement, does this help to basically give a patient a better success rate?
Ideally. Okay. Ideally, yeah. So I like to have patients implement these lifestyle changes prior to me drawing their blood. Okay. So what we eat makes up our cells, right? So the healthier your cells are, the healthier that plasma is going to be, right? And the growth factors and the anti-inflammatory meters will be. So we do everything we can to help people optimize that. But there is a component that the patient has to participate in. So, you know, they've got to be committed to this.
Now, once they have one of these injections done, whether it be knee, shoulder, hip, you know, do they need to, after they see you, do they need to stay off of it? Do they need to then, you know, go and do physical therapy? What are some of the, you know, guidelines that you suggest?
For some of these procedures, the pain can get worse, substantially worse, for maybe a week or two post-procedure. So during that week or two, I just recommend patients take it easy, treat their injection site as if they had surgery. I mean, you can obviously, if it's a knee and you have to work, you still work. Just, you know, limit your activity as much as possible. Just in order for that area to heal. And then usually by week 1 or 2, we begin aggressive physical therapy. And then just working on rehab, strengthening the muscles around the joint, and you know, working with a good physical therapist who understands the whole functional unit and how to keep that healthy. Because with these PRP injections, I mean, the anti-inflammatory effect can take effect usually within 6 to 8 weeks. But the regenerative effects can take months. So this isn't a quick fix. So I tell patients they have to be committed. They have to, you know, be patient with this therapy. So.
And typically, how many, when you have patients come in to receive these injections, typically how many injections are they getting?
It varies from patient to patient.
And based on injury?
And based on injury or based on what we're treating. So, for example, someone might come in with just osteoarthritis of their knee. There's no other ligament issues, no meniscal issues. That'll just be one injection into the knee. So of what we call platelet poor or leukocyte poor plasma, which has anti-inflammatory properties. So the plasma that we get, we can divide it into different types of plasma. There's platelet poor plasma, which we can use for anti-inflammatory, and it also has some properties that some studies are showing that it might actually stimulate muscle growth. So for example, if someone has had chronic knee pain, they've got some quadriceps atrophy from years of favoring and disuse, I might inject platelet poor plasma into the quadriceps muscle. I do all of this under ultrasound guidance. So it's very precision guided treatment. But for example, for osteoarthritis pain in the knee, it's one shot into the knee joint itself. If there's ligament issues, if there's meniscal issues, then I'll treat those areas as well. So, I mean, in one setting for a knee, a patient could get 3 or 4 different injections, depending on what we're treating. Same thing for the shoulder. Same thing for the hip too. So.
And then, can patients use this as a type of preventative measure to help keep their joints healthy?
That's a great question. That's a great question. I don't think there are any studies out there that I'm aware of that have shown that that is an option. So typically, we're not doing it preventive.
But would it harm anything if somebody came in and did it preventatively?
No, other than you know, a little bit of a hit to their pocket, but but then also maybe just the discomfort from the injection. But,
And typically, how long does the discomfort last?
Anywhere from 2 to 4 weeks. Yeah, I mean, so I've had this procedure done to myself 3 times now since July. And I can tell you that my knee gets horribly worse and painful for at least a few weeks afterwards. I mean, to the point where sometimes I'm even limping. So, and then it slowly improves. So after 3 injections over the course of the last 9 months, I've noticed profound relief in certain areas of my knee, and then some areas that still need treated.
And did you have an injury that caused your pain?
Yeah, so I've been working out since I was 13. I wrestled, I lift heavy weights, I was a mountain biker, played racquetball, tennis, was a runner, hiker. And kind of beat up my knee. My left knee, for some reason, took all the brunt, maybe because I'm right side dominant. But yeah, so my first treatment, we found I've never had an MRI done, but I saw one of my good friends, my mentor, Dr. George Changshan, and we did an ultrasound exam of my knee. We found a lateral collateral ligament tear, which was exactly where my pain was. It was mostly lateral. We also found some other pathology in my knee that wasn't painful, but that was there. So the first injection really focused on the arthritic changes in my knee and then also the lateral collateral ligament injury. And I would say that we did that in July. 3 months later, that was almost completely healed.
Oh, wow.
Yeah.
Okay.
So the second injection we did, we treated my medial meniscus, which was extruded. So
Okay.
that's a condition where the meniscus is outside of its normal confines, kind of like a disc slip. You
Okay.
get a meniscal slipping out of place.
Okay.
So, but it wasn't terribly painful, but it was causing some stress on my medial collateral ligament. So
Okay.
we used a specific type of platelet-rich plasma to treat that area. And then there was also an issue with my infrapatellar tendon, which is the tendon right below the kneecap.
Okay.
And so we treated that as well.
Okay.
And the medial aspect of my knee got better in 6 weeks.
Okay.
The patellar didn't. So we
Okay.
injected that again in November. And that, I would say, is 50% better
Okay.
now.
And
Yeah.
if you had done physical therapy regularly,
yeah.
you probably would see a little bit more
So, yeah.
of a better result.
They always say doctors make the worst patients, right? So that's one thing I did not do,
Okay.
was be consistent with my physical therapy. Yeah.
Yeah, because that, like you said, that helps people.
The whole functional unit.
Yeah,
Yeah. Strength.
okay.
Yeah, exactly.
Okay, so you've answered a lot of great questions. Another question I have is, who wouldn't be a candidate for a PRP injection?
So people who are potentially surgical candidates,
Okay.
right? If they do have a surgical lesion that can be treated surgically, ideally those people would go get surgery.
Okay.
Like I said, this isn't pixie dust. It's not going to cure everything and fix everything. But people who smoke also tend to be at a disadvantage when it comes to
Okay.
their plasma and their ability to regenerate and heal tissue.
Okay.
And also people who are not living an active and healthy lifestyle.
Okay.
So, in our practice, I like to really be selective with who I offer this therapy
Right.
to.
Right.
And the patients, let's say, there is a smoker or a person who smokes who's not, who's very interested in this. We'll come up with a plan for smoking cessation.
Okay.
Then if something they can do, I'd like them to be cigarette free or smoke free for at least 2 months.
Okay.
And if they're motivated to do that and have the resources to do that, then they may be a candidate. But
Okay.
people who are on blood thinners
Oh, okay.
that affect platelet aggregation,
Okay.
they may not be a good candidate for this.
And what is platelet aggregation?
Oh, sorry, the ability of platelets to work and
Okay.
and clot, if you
Okay,
will.
okay.
So they can have some adverse effects on the platelet-rich plasma.
Okay.
So.
Another thing that's great about the PRP is that when you come in for an injection, whether it's for your shoulder, hip, your knee, if you have extra PRP, you can come and see me and I can do a PRP facial. So you can use the same technology using all of those platelets, and you can do skin needling, skin pen. We use the skin pen at Integrated Spine Pain and Wellness. And then we just put the PRP over it, and it goes in and actually regenerates the cells in your skin as well. So it can help boost collagen, elastin, it gets rid of acne scars, helps with hyperpigmentation, fine lines, wrinkles, really beneficial. So, and it's another form of your body naturally healing itself and reducing the appearance of aging and helping kind of slow down that process as well. So it's interesting. For more information regarding PRP injections and some of the aesthetic procedures that we do, you can visit our website at www.ispwscottsdale.com. And on our website, you can find a list of information regarding different conditions that we treat, chronic pain conditions, aesthetic procedures, as well as blog posts that we do regularly on different pain topics. So thank you for joining us, and stay tuned for further episodes.